Good afternoon, everybody. My name is Sean Robbins, President of Regence BlueShield, Idaho. Thank you for joining us today for what I hope will be not a webinar, but more of a fireside chat, particularly as the state engages or begins phase 2 of its reopen plan. This is the first Monday of the state's phase 2 reopening. And over the weekend, depending on where you are in the state, you may have seen quite a lot more activity in restaurants, street life, across the state. We certainly did here in the Boise area. I know our friends up in Quilane had similar experiences. So it appears that the weather, the reopening, and people's general desire to get out and about have sprung back into life across the state. And so as we deal with a reopening of the state, we want to bring in a conversation, the first in an ongoing return to work seminar, webinar, to help give you a mental model of how to think about your own businesses, supporting your own employees, thinking about how you engage back in the workplace, back in the office, how you navigate not just the current circumstances, but also the circumstances later this summer and into the fall, and try to look around the corner out what's coming. Before I turn it over to some of our guests, I want to just take a moment to express some gratitude. What you're seeing on the screen has been our North Star along through this experience, Regence BlueShield of Idaho, about our members, our employers, partnering with our providers, our communities. But I want to say thank you to all of you on this call. Many of you are customers of this company for a very long time, for your partnership, particularly with our account managers and the frontline teams that support you throughout our organization every day. Over the last 8 weeks, many of us had to adjust to a very new reality, but these folks and folks in your organizations have done a heck of a job trying to navigate that environment, support your employees, and quite frankly, stay bent at the knees as we've navigated through this together. So just a very humble thank you and my deepest gratitude for your partnership and for the teams inside our organization who are working to support you through this together. Now, as I said, this is the first Monday of the stage 2 reopening in the state. And of course, gyms and restaurants, venues, hair salons like that are now open. In some cases, quite literally, in other cases with some restrictions, but almost in all cases, employers are implementing social distancing guidelines and best practices. Over the weekend, you may have seen the Governor Brad Little announced that he would be making a 30-day supply, a proactive 30-day supply of PPE equipment to small businesses across the state. If you haven't seen that announcement or are interested in access to those resources, I encourage you to visit supplies.idaho.gov. That's supplies.idaho.gov. Whether you're a customer of ours or you're a broker who supports customers, getting access to PPE is going to be incredibly important as we navigate this environment together. And the governor and his team are doing an excellent job of trying to open up those resources across the state. A part of my work at Regence, but now on the governor's task force for economic recovery, has been working to try to identify the big strategic dominoes we can do, public and private, together, to try to help support you in reopening and move the state forward in a safe manner, but in a way that also supports the economy. Over the next few weeks, starting later this week, you across the state will start to see a public relations campaign across multiple channels, social, digital, text, copy, really trying to identify the best practices and techniques and tools about how to be a safe employer and how to be a safe consumer in this economic environment that we're in. We want to drive consumer confidence across the state. We want to support the economy, and the governor and his team want to do just that. But we also do it in a way that supports the health and the management of COVID-19 for the long term, not just the short term. So over the next couple of weeks, be sure to look for that. I also want you to know you can give us feedback as we work with the governor's task force, with our partners at the Department of Insurance, Director Dean Cameron. We encourage you to submit things you're seeing on the ground in the market in real time to folks on our team who can get it to me, and we can make sure that the governor and his team are getting real information from the marketplace across the entire state. So we're entering a new phase. It's phase 2. We have a phenomenal conversation teed up with two people, one of whom you know and one of whom you also know, but maybe a different way. Former Secretary of Health and Human Services during the Bush administration, and former Utah Governor Mike Leavitt, who has some experience of his own during his time at HHS in Washington, D.C., dealing with global health pandemics and being a chief executive of a state. We thought it would be phenomenal for this audience to hear from a leader like Governor Leavitt, who has experience in this space, but who also runs a firm today, Leavitt Partners, that's deeply engaged in health benefits and deeply engaged across state and federal government, advising not only on where we are today, but in my old Midwestern nomenclature, where the puck is going. And how do we skate to where the puck is going, not just where it is today. Of course, we've also invited our own executive medical director, Dr. Amy Kahn, to join us. The asterisk next to Dr. Amy Kahn's resume, as many of you on this call already know, is trained epidemiologist. There's a lot of information floating out there from a lot of sources, some reputable, some questionable. Epidemiologists are the one that I tune into recently because I'm looking for the data and just facts. And we wanted Dr. Kahn to join Governor Leavitt for this conversation because we think it'll help you really create that mental model that we're tasked with trying to support you as you reopen on. Now, on your screen you say real quickly, how do we engage in this? Well, we don't want this to just be a one-way conversation. You heard me say I wanted it to be a fireside chat. So after we hear from the governor and Dr. Kahn, I encourage you at your screen below, there's a Q&A tab. Don't mistake that for your chat tab, your Q&A tab. Please submit questions as the presentations and conversation unfold. We're going to save the last 20 minutes for you to be able to ask the governor and Dr. Kahn questions. And the more poignant to your business and the community you're in, the better. We want this to be applicable to you and the work that you have in front of you. I'll moderate that conversation, grab as many of those questions as I can to tee them up to Dr. Kahn and to Governor. So without further ado, I'm going to take a step back and turn this first part of the conversation over to Governor Leavitt, who we're thrilled and honored to have with us today. Governor?
Sean, thank you. I'm delighted to be joining you. And as you said, the big news today is that Idaho is returning to business. In fact, it's more than just business. Our communities are beginning to re-enliven. It's a good feeling, and there's lots of reason to be optimistic. Having said that, we are dealing with the reality that COVID-19 is not a problem we're just going to immediately be able to solve. This is a longer-term issue that we're going to manage for a while. And what we will be talking about today are ways, tools that we can return to work and do it safely and continue to begin to see our economy return. I'd like to talk for just a few minutes about the process of opening up. What does it really mean? I think, first of all, it's important to acknowledge that opening up is a gradual process. And it's a gradual process during which time we're going to make a shift from what we can refer to as group behavior to individual behavior. Now, the group behavior would be things like staying at home, closing businesses, no public gatherings. We can all do those in unison. We can be clear about it, and often, and most often, it comes with some kind of government encouragement. Individual behavior, we all recognize ourselves as an individual, but we also ought to be thinking about businesses as an individual, or different groups, even families, who will make decisions on their own judgment based on information, some of which we hope to provide today. So this gradual shift between group behavior and individual behavior doesn't happen all at one time. It doesn't mean we're not doing some social distancing. We clearly are. It doesn't mean that we're not encouraged to wear a mask. That's a group behavior. But the decision to do it is actually an individual decision. We'll be encouraging you to take the right kind of individual behavior, make the right kind of decisions individually. The second thing I'd like to talk about is social distancing, a word we've all become very familiar with. I think it's valuable to think about social distancing as a medical intervention. This is medicine, basically, that we're applying to a problem that we don't have a vaccine for or a medicine that we can just readily apply. Medicines have side effects, and it's obvious that this medical intervention called social distancing has had some side effects. I have a friend, and you may know someone as well, or it may even happen to you, that had an injury or some medical condition that involved pain. And they were provided medication to help diminish the pain. But they were told, you can't use this forever because it'll have side effects. They were told you can't overuse it. Well, the same thing can be true for social distancing. We've begun to see our economy take on a major hit, and we can't survive it forever. We have to begin to return to work, and that's what this is about. There's also personal ramifications, and we'll talk more about that. So we are making this because while social distancing has worked, there are limits to how we can apply it. It doesn't mean we won't go back and have to do it again, but the point of this whole, my point is that social distancing has limits, and we're now going to make a tactical shift in our strategy. I'll now move to talk about opening up as what we need to accomplish during this early period. Again, it's a gradual process, and it's one in which we rebalance and we learn. It's not a declaration of victory. There may be times in the future when in some form we have to return in some areas to a little social distancing in one form or another. But we aren't declaring victory. What we are declaring is it's time to rebalance and to relearn. COVID-19 is a new risk that we face in our lives. We're facing it as individuals, we're facing it as businesses, and each of us will be affected in different ways. And we'll respond to it according to our own priorities, our own circumstances, and our own risk tolerance. Let's talk for a moment about circumstances. If a person falls into a group where they are because of age or a pre-existing medical condition, that's a circumstance that still requires great care, substantially more care than someone that is not in that situation. Risk tolerance is another. There will be times when people who have a low risk tolerance worry about people who are not caring to the degree that they think they should. So this is going to require us to be less judgmental, but at the same time recognize we all have a need and that we'll all likely be responding to this in different ways. And finally, I'd like to just talk for a moment about a category of learning. I mentioned this is a time during which we will be rebalancing, but we'll also be learning. One of the things I think we all have to learn is how to practice social distancing in a way that still allows us to live a fulfilling life. Like many of you, I have parents who are in that category of being at medical risk. And I suspect, like many of you, I've been working with them to find ways in which we can protect them and be able to provide them with a safe environment. But we're now reaching a point where even the most patient of us have begun to say, I'm feeling cooped up. I have cabin fever. I laugh when I say this, but I got a call from my father, who is 91 years old and very active. And he said, Mike, I just want you to know I swam the moat. And I went to the office. Well, I knew that the office didn't have anyone there, so he was probably okay. But what I learned from that, and I think we're all feeling it to a way, is we're ready to swim the moat. We want to begin to have activity that allows us to live a more normal life. The good news is there are ways in which we can socially distance, continue to apply social distancing, and keep ourselves safe, and be able to expand the number of things that we do in order to be able to do it safely. And that should be the conversation that we begin with Dr. Amy Kahn. Sean mentioned she's going to be with us. Dr. Kahn is the Regence BlueShield of Idaho Medical Director. And in her job as Medical Director, it's her task to look after the care that policyholders of Regence BlueShield of Idaho receive. And so she has an important role in many of your lives. So Dr. Kahn, we're delighted that you're able to join and look forward to finding ways that we can move back to work and stay safe. Help us out.
Great. Thank you so much, Governor Leavitt. Pleasure to be with you today, and all of you, thank you for joining in our conversation. It is an exciting time in Idaho. I think many of us can relate to that feeling, cooped up feeling, and kind of ready to get on with things. I want to start by saying I think we all not only want to just exist through this extraordinary time of COVID, but we really want to get back to thriving in our lives. And the important thing for us to understand amidst all this uncertainty, right? We're still waiting for adequate treatment or effective vaccine. We're not sure exactly how this virus is going to behave in terms of those who may have already been infected. But what we do know is we know how it's transmitted. And I think it's important to embrace ourselves as part of this community of workers, co-workers, employers, family members, all of our lives, if you will, to understand the essence of public health, which is essentially what we do collectively to assure the conditions in which we can all be healthy. And so with this first piece about adoption and adhering to best practices, I did want to sort of say, yes, we're going back to work, we're going back to start living our lives, but common sense would tell us that it's important to stay physically distant, particularly when we are with people outside of our immediate families, to encourage people to wear a cloth mask to prevent the likelihood that this virus could be spread to another person through droplets. Maybe it's not just coughing, right? Or sneezing. We know if you're close with another person and engaged in conversation, there's a likelihood that someone who's infected could potentially spread that through small droplets to another person. And then lastly, everyone's learned how to wash their hands, right? 20 seconds soap and water, right? Sing the song twice. It's an important practice for us to uphold, covering our cough, using a tissue, disposing of it when we're through. All of these things are really what we ask of each other. But in addition to that, from a public health perspective, and our health and welfare department encourages those who have symptoms that are suggestive of COVID get tested for the virus, and those who are infected stay isolated, away from circulation, away from others. In addition, persons who have been confirmed to be infected, they need to be identified so that others who have been in touch with those folks at least 2 days before they had shown symptoms be identified so that those individuals who've been exposed can be quarantined. And that's collectively really how we want to think about going forward to protect each other, to protect our families, our coworkers, your business, as we reopen, if you will, to serve the community. I want to focus a few comments on the recommendations that have been put forth by the Centers for Disease Control and Prevention, or CDC, as well as OSHA, Occupational Safety and Health Administration. These are available online. I'll make sure you have the web link, but I did want to identify a couple key areas that you would want to consider as we open up into this second stage of Reopen Idaho or Rebound Idaho. And the first is consideration of a policy that says if you're sick, don't come to work, right? Really letting people know, don't come to work if you're having symptoms. For those who do show up to work, we want to screen those individuals for cough, fever, right? Shortness of breath, other symptoms, and have them go home. And if you get sick at work, go home, right? That's important in terms of really helping to keep your workers safe and protected from ongoing spread at the workplace. Other considerations would be those safety measures, offering those cloth masks, actually erecting some physical barriers between workstations or separating workstations by 6 feet, maybe even the lunchroom, separating tables out for individual use. In addition, making sure that there's hand sanitizer or hand washing stations, looking at the frequency of cleaning and disinfection are going to be very important considerations, as well as overall operations. Maybe looking at staggering shifts so that there's not as many people at the workplace all at one time, maybe starting earlier or staying open later. And of course, let's not forget your patrons, right? Our customers. It's really important that there's good messaging, signage that allows individuals who might be coming to your place of business to know what you're doing to keep them safe, to keep your workforce safe. Maybe it's offering hand sanitizer, requiring or requesting a mask, offering a mask. In addition, thinking about ways to proactively serve your customers without putting anyone at risk, anticipating what sort of supplies might need to be ordered, particularly since it's been a couple months, say, since you've been open, as well as considering things like curbside service, order ahead, home delivery. I think we've all appreciated the value of home delivery during this extraordinary time. And then again, adjusting flow. We know that in many places, just sort of orienting the customers to go down certain aisles in one direction to mitigate the likelihood that there'll be a bunch of folks aggregating together, putting marks on the floor at least 6 feet apart. Again, those are ways to continue to keep your patrons safe and healthy, along with your workforce as they continue to provide good service and help rebound, if you will, in terms of our economy. I did want to make a couple special comments about the most vulnerable in the population. As you all have heard, older persons as well as people who have chronic conditions, things like diabetes, heart disease, lung disease, folks that have gone through chemotherapy for cancer or have immunocompromise are more likely to have much more severe infection. And so it makes sense to go the extra mile to keep these individuals protected. It may be people in your workforce, identifying those individuals proactively. Maybe there's opportunity for telework, or really inviting folks to continue to use Zoom meetings, or those folks participate through Zoom meetings. We also know that there's sometimes work duties that might be able to shift, right? Do some cross training, allow folks to be able to flex, maybe offer for your patrons certain times during the day to come into your store or to obtain your service, but perhaps it's a less busy time. This notion of, again, working collaboratively so that we can all stay healthy and ultimately help thrive as we move through this extraordinary time is going to be really important. Recognizing that as much as it's an individual choice, we're all in this together. So I wanted to pause and just conclude my remarks to say that I'm looking forward to some continued questions around strategies that you might consider or other resources that we might be able to offer you to feel confident. We're very aware that folks are anxious, feel worried, and if you have sick ones at home or persons are in that higher risk group, folks that are going out to work also feel a worry or concern that they might bring something home to mom or bring something home to another family member. So thank you for this time, and I'm looking forward to our dialogue.
Well, thank you, Amy. And I may just remind those who are participating today of that Q&A button on the bottom of your screen. We'd love to, Dr. Khan and I are going to be able to take your questions, and we'd love to hear from you. Dr. Khan, for just a few minutes, let's you and I talk. I thought some of the things you said were really important, and I'd like to just ask some questions myself. Just assume for a moment that as the medical director for BlueShield, Idaho BlueShield, that you get a call from a policyholder, the HR director, and he or she says to you, I've just discovered that someone in my business has COVID-19, and I need advice on how I should go about responding to this. I'm concerned that people will be worried about it. I'm concerned that they'll feel unsafe just because they may or may not have been exposed. But could you kind of walk us through how you believe an HR director should be responding to this kind of a case?
Yes, thank you so much for the question, Mike. You know, I think we can expect this, right? There will be situations where you're going to have an employee who is sick or infected with COVID-19. And this is why it's so important as we contemplate the reopening of the business to think through what policies need to be put in place, recognizing that this will likely happen. So persons who say become ill, or you become aware that there is a person who's ill in the workforce, at the workplace, be very important to establish the policy that that person is removed from their duties, right? We want to remove that person from the workplace. Obviously, advise that individual, if they're symptomatic, that they seek medical attention. But most important is that that infected person goes home and home isolates, if you will, if they're infected. And that would require a couple things. Most important, and as we've gotten more tests available, is to get tested, right? To confirm the diagnosis. In some cases, testing hasn't always been readily available, so it's more of a symptomatic approach. But in either case, we would want that individual to be home isolating, away from others, and assure that they're no longer having symptoms for at least 10 days from the beginning of the symptoms, and for at least 3 days have no temperature, right? In the case where there have been tests available, it would be important for a person before they'd come back to work that they would have a negative test for the virus, 2 of those tests conducted within 24 hours before they return to work. I think that's a really important piece in responding to those who you've become aware are infected with COVID.
Thank you. That's really helpful. And I'd like to just offer one suggestion, really, to not just HR folks, but to those who lead businesses. As Sean mentioned, during the time I was Secretary of Health, there was worry about a virus called the H5N1, which they thought had pandemic potential, and we developed the National Pandemic Response Plan in response to that. Part of what we learned was the value of using of gaming out situations or practicing, if you will, sometimes how to respond. So something that business leaders, HR leaders, etc., could consider is actually, before it happens, sitting around a table and actually developing a scenario so that everyone gets a chance to practice, even if it's just explaining what they would do and how they would respond to others. This has enormous value because it causes us to think about things we hadn't done. So if you haven't done this, if you haven't sort of done a tabletop exercise or exercised and practiced how you would respond to this, that might be a good idea in preparation. Dr. Khan, have you had experience with that yourself?
I have, and I will just say in full disclosure, I let the governor know when he was secretary. I was working for him. I was at the CDC at the time, but we just didn't know each other. But yes, we did quite a bit of pandemic preparedness and planning and practicing, and I wholeheartedly agree. In addition to developing the policies within your workplace that you are planning to establish, it makes sense to float these scenarios so you can feel prepared and confident in how to respond. I did want to also say, in kind of follow up to my last comment, I wanted to be clear about the difference between isolation for infected persons and quarantining for people who've been exposed. And it is true, let's say in the case of that person who was, say, infected at the workplace, those individuals who were exposed to that person 2 days before they became symptomatic would also need to be quarantined, right, for a period of 14 days, which is the outside bounds of the incubation period for this novel virus. So it's a good question, and these are a distinction, and it's likely, not always, but it's quite possible someone who was infected, who may not have known that they were symptomatic or hadn't developed symptoms yet, could have spread this infection to an asymptomatic or unexposed person, at-risk person, I should say, and that person could acquire the illness down the road.
So let's go a little deeper, maybe even into the home. You know, the HR director has been called, they've begun to take the actions at work, but you now have an employee who's dealing with a really hard situation, and that is having a sick family member or a loved one that has a disease that can be a little scary. Recognizing this is probably not in your role as the medical director for Regence, and it may not even be the role of the HR director at work, but this person needs some advice. What would you say?
Yeah, it's a great question. And again, not an unlikely scenario. I think I'd anticipate it. Sick family member at home, you've got one of your employees there who's the spouse or the son or the daughter. The recommendation by the CDC is that that member stays home. That member does not come to work. They'd be considered an exposed person and would need to be quarantined for a period of time, that 14 days. And if they are not showing symptoms, they're asymptomatic, they would be able to come back to work. But we would definitely treat them in the same way as if they were exposed to someone who was infected outside of the home, at work, or even in the community.
How would you, if you were that person, how would you protect yourself as best and still show the loving care that you'd like to give your loved one? What kind of protections can you do while you're caring for someone who's ill?
Yeah, it's this is absolutely the biggest challenge, right? The isolated or infected person who's isolated stays ideally in their own room, has food brought to them, maybe uses, if there's 2 bathrooms in the home, isn't always, but that person would use one bathroom, the rest of the family uses the other bathroom. Obviously, the family members want to wear masks, right? Want to be very, very mindful of hand washing, being careful not to contaminate oneself, particularly there may be an opportunity to use gloves in bringing food or taking the dishes back, if you will, being careful, again, not to contaminate oneself when taking the gloves off or taking the mask off. But it would be an important step to assure that the member or the worker themselves doesn't get infected, or anybody else in the family. I'm thinking of children, right, who may or may not be able to completely understand the importance of it, but nonetheless would need to be supported to sort of limit their contact with their loved one. If it's their mom or their dad, being able to see them from afar, but understand that they're not going to be able to run in there and give them a big hug.
Well, one might ask, we just had a celebration about returning to business, returning to work, and here we are talking about all of these situations. Just put it into context. That's because we're likely to see this happen. And we are returning to work, and that makes it slightly more likely that we're going to see this. And so if we're going to have this opening up, then we have to begin to figure out how we can open up and be safe, because this is a long-term proposition, not one we are just going to solve. This opening up is not a declaration of victory. Let's talk for a few minutes about how we can give customers a sense of well-being when they come into our office or to our store or onto our construction site or into our restaurant or into our school. You have any suggestions on that, Dr. Kahn? What can we do to give people confidence that they can be safe there?
It's a great question. And again, I think we need to acknowledge that at least half the population feels a bit anxious about this opening up, whether that's going back to work or going to a place of service or a place to purchase supplies, grocery stores, what have you. So I think first and foremost, it's to be really upfront about it, right? Good signage. We want to protect you. We're protecting our workforce. Here's what we're doing. We recommend the use of cloth masks. We provide cloth masks. Here's hand sanitizer. Being very upfront to reassure the public, your customers, your valued patrons, that you are taking care of them as well as your own team to be able to continue to provide good service or business to them. I think that the use of technology couldn't be more important. We've seen that in healthcare itself with the robust adoption of telehealth services almost overnight, right? We've seen practices go from 10 to 90% of their visits being done virtually. Same thing with other kinds of businesses, whether it's a package, pick up and go kind of a service and food service or curbside delivery or actual home delivery. I think there are a number of ways in which we can help serve those customers and help them feel confident that they are going to be served well without the risk of acquiring this infection. And then lastly, things like our televideo conferencing and thinking about some of those more vulnerable patrons, right? It's really important, that we recognize that these are the folks that, probably have the greatest anxiety or their family members do. So as a business, really accommodating those concerns and those needs of those that we need to take some extra measures.
So, Amy, one of the things I've observed, both as a leader as well as watching all of this unfold, is the importance of how we communicate with customers, the way we communicate with employees. And I'd offer three thoughts. The first is giving employees tools to stay safe is a message to them that you care, and they're more likely to feel comfortable and to come back to work in a way that will make them productive. So the first thing is communicate, 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 and that we can, the second is that we can do it not just with words, but with symbols. Symbols are important because they go way beyond words in the way we communicate, and they communicate meaning. Let's shift for just a moment to customers. I walked into a grocery store recently, and there I saw a employee of the grocery store sanitizing the handles of all of the shopping carts. Then I saw a plastic shield that had been put up to protect not just me, but the cashier. Those were symbols that communicated in powerful ways that this store cared, wanted me to be safe, wanted me to feel comfortable in coming there. Amy, any other symbols or tips on good communication that you'd offer?
Yeah, thanks, Mike, for suggesting the symbols. I think that's also important in just really making sure that we're communicating across all cultures and all levels of education and all ethnicities. We know that there's some health disparities around this pandemic that are important to recognize. So even pictures of the hand washing, pictures of the face masks, kind of reinforcing, if you will, those health behaviors or practices, I think are wonderful. There's been some terrific and very creative artists out there who've been showing, illustrations of distancing and things like that. I think it's important as we, again, how do we continue to not only exist, but thrive and support each other? I think that's incredibly important. But you mentioned one other piece, and I want to pick that thread up, Mike, and it has to do with, again, reassurance. We all have some level of anxiety. Most of us do. That's natural. That's actually normal. So how do we sort of help each other around those emotional health needs, that sort of free-floating anxiety, if you will? Not only, of course, would we encourage your employees, our members, to access some of our behavioral health services, but there's just a host of apps, opportunities to get online. There's practices like breathing practices, mindfulness practices, just getting some regular, fresh air, some exercise, really helping people engage in strategies that are not only going to help reduce that level of anxiety, but ultimately help them with, better immunity, getting better rest, for example, because these are things that are going to persist through this time, because quite frankly, we're uncertain. We're uncertain about the timeline. I know that there are many parents that have worry about their kids. It's been an extraordinary time as it's turned out with the rest of the school year. We've missed major events, graduations, milestones. We're looking at a summer where most camps have been canceled, and now we're talking about a fall that may look very different in terms of homeschooling. So I do feel that as we think about this planning, again, collectively as a society, and each community may have a slightly different solution, we need to engage all of us in that dialogue as we move forward.
Well, thank you. Sean, I'm guessing there are some questions that have come in from just looking at the Q&A at the bottom of my screen. What are people asking?
Well, you're right, Governor. There's been a number that have come in, and there's also been some that have come in direct. And so I'm going to try to, been writing them all down. I'm going to try to intermix and connect the dots here on a couple of key questions that have some overlap. I'm going to actually answer first question, a couple of questions that all relate back to the state's reopening plan, particular questions around industry-specific reopenings as well as protocols. To your point, Governor, communications. For the folks on the phone in our audience, I'd highly encourage you, if you haven't already, to visit rebound.idaho.gov. There was a question around large venues, theater, sporting events. That is a stage 4 reopening within the governor's plan. They're on stage 2 today. That entire document and blueprint that Governor Little has laid out is available at that website, rebound.idaho.gov. And in it, particularly for our employers on the phone today, I think you're going to find there's some good protocols to create consistency that mirror what Dr. Connor's saying and what the governor have said about best practices. No matter whether you're open or not, there's still things that we need to be doing, including social distancing and personal protective equipment and disinfectants and cleaning, quarantining sick individuals. That website continues to be the single best consistent resource for folks in the state of Idaho, particularly employers, to understand where they fit and how they can operate with a consistent set of guidelines. But Governor, I want to shift to a question to you, if you wouldn't mind first. And there was an individual who actually think this very well. And as a father of a 13-year-old and an 11-year-old myself at home, I just want to read it. So we have many employees struggling with homeschooling their children and working. And now we're hearing that school may not be open in the fall. I have employees asking for our EAP and saying they can't do all of this, especially single parents with multiple children. Some of us are not meant to teach our children. I might be one of those. I'm seeing a spike of employees and neighbors have a hard time even coping. And I connected that to this data that we just received from McKinsey recently, where half of consumers who have employer-based insurance are experiencing a high need for mental health services, as Dr. Khan was inferring at the end of her remarks. In fact, 63% of people on employer-based coverage today describe themselves as feeling either anxious and depressed or anxious at least. And that was the end of April with a statistically significant sample size. And anecdotally, we're seeing in Regence our own telehealth claims for behavioral health go up significantly as people have adapted to the telehealth environment. So I'm just curious, Governor, from your perspective, how should we as a community, as policy leaders, as businesses, thinking about supporting our employers who are trying to turn to support their employees be well and be not just productive, but be well in their mental health, particularly balancing and juggling all these balls?
I think we have to start, Sean, with a kind of general pledge of patience, not just with ourselves, not just with our children and people we love, but also the people we work with. We had a little chuckle before about the newscaster whose a 5-year-old interrupted his international broadcast. We're all going to have that kind of thing happen. We're likely, when we start getting into how you deal with anxiety, some of it is just acknowledging the situation. And I'm not a physician, so I won't pretend. Maybe Amy can help with that. But I will say this. A good friend of mine told me recently about knocking on a neighbor's door who she was worried about because hadn't seen any sign of them. The drapes were closed and they knew that they should be in there. Knocked on the door, no one came, and then they saw a little slit in the drape. And then the door opened, and behind the little peek in the door, a woman said, "Where's your mask?" That is a situation where a person is obviously feeling deep anxiety. And we have to find a way in this period when we know it's going to be present to learn to stay safe, but to live a fulfilling life. And there are ways we can do things that will give us that balance that's required. For example, I'm a grandparent and I miss my grandchildren, but I have learned that I can social distance and still see them. I am a person that likes to go for a walk. I can do that. There are ways we can use social distancing skills. Amy, I'd love to hear your point of view on this. You used the word thrive a couple of times, and we need to learn to thrive in hard situations, living a fulfilling life, but still learning to keep the rules.
Yeah, thanks. And if I could just piggyback on a couple things that you've mentioned, and it's that we're human, we're social creatures, right? We need to connect with each other. Now, whereas we're not going to be doing our traditional handshaking or hugging, every culture is a little bit different, that's not going to be happening. But we can still be in touch with people. And actually, having a teenager myself who's been, challenged with not being able to hang out with his friends this spring, we have a rule. He has to connect with 2 friends a day, really socially connect on some kind of FaceTime or what other link they have to really spend time with their buddies. And it's helped. And I'm just sort of thinking it's the medium that's changing, right? The medium that we're existing in has changed quite a bit. And, a lot of times, we ask, well, how long is this going to go on? I don't know. We're going to find out. Hopefully we'll have a vaccine within the next year or 2. But we know that we've got to continue to thrive and have fulfilling lives and be successful in our businesses. So I think you really hit it spot on. We have to be able to use the tools that we have and leverage those things that may be less familiar, but are available to us, to our families, to our coworkers, to stay connected so that we can, again, derive meaning in our life.
So, Amy, I want to ask a question. Excuse me, Sean, I know you've got another one, but I hear a lot of people use the word pod. A pod, meaning a group of people that you have confidence in, that you know how they're social distancing. And is that a sound concept from an epidemiologic standpoint? Can we form a little group of people like our family or maybe even a few people in extended family that we can interact with more if we know what they're doing?
Right. So this is a notion that actually I've become more recently aware of. Some people call it quarantining, which I thought was very clever. But it's this idea that we can start socializing more broadly with people outside of our homes or households in whom we sort of have this sort of covenant of protection. What I would say is that it's certainly not something that is being recommended by our public health authorities. There has not been any data to support this, but I will say people are trying it out. Of course, it does have the risk of people who you don't know, who perhaps aren't as maybe mindful or not as consistent in engaging in best practices, who might become infected or exposed and then end up infecting that whole cluster or pod or quarantine, as it were. And I think we're going to be seeing some of this in the next several weeks as more people are venturing out and trying to sort of reestablish some sense of community. But we may see that there's certain families that might be suddenly spreading to each other. So it's a great question. I wish I could tell you for certainty yes or no, but I feel like there's some risk inherent in that sort of activity, just simply because it's more people to potentially bring in that disease.
No, thank you. So this is a period where we're going to be rebalancing and learning. Sean, let's go to another question.
Yeah, Governor, I'm going to pivot to you, and then I'm going to come back to Dr. Khan with a testing related question that was pretty prevalent with our audience. There's been some talk about this is in really trying to get our employer out in front of where the puck is going, not just what is today type of question. So thinking ahead to the fall third quarter, fourth quarter, and there's been discussion about a second wave or spike that could potentially result as states reopen. And I wonder if, mixing with the flu at the same time, which is typically when the flu becomes prevalent, how do we help our employers, our government leaders, and our communities try to deal with that wave that may come and mixing with the flu at the same time? And Dr. Khan, feel free to weigh in here too. I don't want to put this just on the governor's back, and I know I'm asking a little bit of looking into the crystal ball, but I can see this coming in the third and fourth quarter. I can imagine that employers are going to have these questions in August, September, and increasingly into October. I'm just curious how either of you think about that. Governor, maybe start with you.
So Sean, I've had the circumstance to spend quite a bit of time studying pandemics over the course of centuries. And what history teaches us is that most pandemics have a second and a third wave. To a large extent, they deal with the sociology we're talking about right now as people begin to mix, and there's more hosts for the virus, and math takes over. So we have to be very conscious and do everything we can to prevent it, but we also need to acknowledge that it could happen, and that if I'm a business owner, and I'm thinking about October, November, December, and what did I learn in wave one that would allow me to be better at wave two? And the reality is we'll probably not have available to us all of the social distancing tools that were used simply because of the economy, and people have used that medicine as much as they're prepared to. So I would just say we have to accept the fact that it could occur. We could be complicating it it could be complicated by the flu. It could be a rugged couple of months, but it'll be a better couple of months if we've thought about it, prepared for it, and done everything we can to minimize it. Amy?
Yeah, thanks, Governor Leavitt. I think you're spot on. I think history tells us a lot, and whereas we've never seen this particular virus before, I think we will see some waves. I hope they're more like ripples. I think the concern, of course, is that we don't overwhelm our healthcare system as a result of just having such a rapid increase in the number of cases that we are no longer able to treat individuals that are most ill. Time is going to tell, how this plays out, but of course I think we're all anticipating with the co-occurrence of the influenza season that we may be seeing an uptick again come this fall.
Can I mention one other thing, Sean? one thing we do know about both this virus and viruses in general is that the healthier we are, the better chance we have to come out of it better, even if we get sick. And so one of the things we all ought to be thinking about is how can we make ourselves healthier in the next 2 to 3 months? This might be a real good reason to improve our diet. It might be a very good reason to begin exercising a little more, because it could make a difference.
Completely agree, Governor. In fact, my wife and I have made a pledge together that we're using the summer months to do just that. Eat better, exercise, get a little better sleep, hydrate, make ourselves as well as we can be in this. Dr. Kahn, last question before we probably have to wind things down, and this is related to testing. And of course, there's been a lot of press around testing, and I would split it between diagnostic testing, do you have or don't you have the virus, and antibody testing, which is do you have antibodies that suggest you may or may not have had the virus at some point. And there have been over 200 tests in the market, none of them fully FDA approved. I think about 14 of them have had emergency use authorization approval. But I know there's been a lot of efforts, well-intentioned, to try to use antibody testing a way to open large venues and employer work sites. But I know that's fraught with some real risks around false positives and a lack of real clinical interpretation there. But can you give a little bit of insight, particularly in antibody testing, for folks about how they should be viewing that and reading that information to be a discerning leader in their space?
Right. Thank you, Sean. It is a really pertinent question, and I think we'd all want to know, am I immune from this infection? Was I exposed and infected and maybe didn't even have any symptoms or very mild symptoms? The majority of people will have mild symptoms. The challenge we have today with the antibody tests that are available is that we don't know a lot about the natural history of this virus and this disease. What we do know is that most people who are infected will mount an antibody response. The tests that are available are not necessarily specific enough to let us know that, yes, it was an antibody to this virus. So there's some false positives. It may have been that another coronavirus, maybe the kind that causes a cold, allowed me to generate antibodies, and that's why I tested positive. So some cross-reactivity of the antibodies. But it also has not been demonstrated that by having an antibody response means I'm immune. And if I am immune, how long am I immune? And then ultimately, we know that there are some people who are still clearing virus, who may still be infectious, that may be antibody positive. So it has its challenges in being able to definitively say this person is safe or not. And we still have an open question about the reinfection risk related to this particular virus. So there's a lot packed in there, and I do want to say I understand the desire to want to know. It's not so simple at this time. What it is helpful for, and what I'm excited to say, is that within the candidate vaccines that are now appearing to be most hopeful, we will be using antibody testing to determine whether or not that vaccine was able to help a person mount neutralizing antibodies, antibodies that were specific and effective in preventing a person from becoming infected in the future. So hopefully that was helpful. I think it's still an area we continue to learn more about, and I hope in the next couple months when we meet again that we'll be able to share more information with you, not only about antibody testing, but potential therapies that might be helpful as we get through this next stage.
Yeah, thank you, Dr. Kahn. That's actually a great reminder that the whole purpose, as the governor said, of social distancing as a medicine is really to buy ourselves time and capacity, time to develop ultimately a vaccine, and the capacity and time for the healthcare system to be able to respond to rates of infection. I really I notice we're up on time. I have about 19 other questions here I would love to be able to ask to both of you. I'm hopeful that we've achieved at least one of my goals of trying to have a bit of a fireside chat, although I notice nobody has a fire going in the background. Maybe in the fall and winter we will. Governor, I thank you for taking time to be here. I know you're personally and your team at Leavitt Partners is on the front line at the federal government, working hand in hand with states to try to help navigate this. Greatly appreciate your contributions to this conversation, and quite frankly, your long partnership with the Regence family of companies. And Dr. Khan, you've been a heck of a partner for me in this last 8 weeks. Well, since we've been working together, but really these 8 weeks together as we tried to navigate this. The last slide you quickly saw, I would encourage you to sign up for a Leavitt Partners webinar that's coming up Wednesday, May 20th from 12 until 12:45 to continue the conversation that the governor and his team are having, both looking at a local level and federal level of what is the data telling us, back to just the facts, ma'am. How do we deal with the facts and how do we implement those facts to move through this together? We're going to be having more webinars like this, again, all under the umbrella of returning to work smartly and safely. We'll be doing it again on May 28th, 11th, and June 25th. We invite you to join us and we ask for your feedback. If there are topics you would like us to proactively prepare for or bring speakers on, we'd love that information so we better serve you across the entire state of Idaho. That, I believe that is my last slide. Click the link below for SHRM credit. And again, Dr. Khan and Governor Leavitt, thank you so much for joining us and bringing your insights to the entire state and our customers. Greatly appreciate it. And thank you, everybody, for joining us today. Have a great rest of your week.
Thank you.